was diagnosed 15 years ago with chronic obstructive pulmonary disease. I had an exacerbation, which led to the diagnosis, and a pneumonia led to my retirement at age 55. I was once a big, strong, active man with many outdoor pursuits, and I am no longer that man.
Saya didiagnosis kanker paru, neuroendocrine high grade. Pertama kali saya merasakan nyeri yang mengganggu aktivitas saya sampai menggunakan kursi roda.
Soy paciente de hipertensión arterial pulmonar grupo 1 por cardiopatía congénita, clase funcional 4, con un diagnóstico de 16 años.
I had very little energy and regular chest infections until February 2022 when I became very unwell and spent a considerable length of time in hospital when I was diagnosed with chronic pulmonary aspergillosis, bronchiectasis and severe adult onset asthma.
The story I would love to share about my client that I managed was a 2-year-old who came in, had been diagnosed with TB. We could only do a chest x-ray and a few other tests, drug sensitivity testing. We didn't have an echo, wanted to rule out pulmonary hypertension because seriously the problem was in the lungs because of the requirement of the low oxygen.
For many, many years, nothing helped and controlled my asthma. Despite being on many different types of inhalers, on oral medications, it was very hard to manage. I lived daily with almost 80% of predicted lung capacity.
أعمل مع المرضى الذين يعانون من الأمراض التنفسية المزمنة مثل الانسداد الرئوي المزمن أو COPD. هؤلاء المرضى يواجهون صعوبات كبيرة مثل ضيق التنفس والتعب وعدم القدرة على ممارسة الأنشطة اليومية.
Although I have not experienced severe symptoms of this rare lung condition, which primarily affects women aged 20 to 40, I have worked closely with patients facing significant challenges. Many have been misdiagnosed, lost substantial pulmonary function, or rely on daily oxygen use. Some have even undergone lung transplants.
I have alpha-1 antitrypsin deficiency and I'm a ZZ, so I have both genes. And this has led to severe lung restrictions, and I've had to give up my veterinary work because I just don't have the lung capacity to treat goats anymore. And this has caused me a bit of distress because I loved my work.
Currently, I am working in the field of the pulmonary rehabilitation for the people who are suffering from the chronic respiratory diseases. In one of the ongoing RCT study at our site, we are trying to assess the effect of home-based PR and center-based PM among the CRD participants.
Soy madre y cuidadora de un paciente que fue diagnosticado con hipertensión pulmonar en el año 2017. Ese momento cambió nuestras vidas por completo. En mi país, a pesar de que tenemos un sistema de salud universal, en el caso de lo que son las enfermedades raras como es la hipertensión pulmonar, se necesitan tratamientos de muy alto costo y esos no siempre son aprobados para los pacientes. En mi caso, a mi hijo le fue denegado el medicamento que necesitaba para seguir viviendo. Como madre, no podía rendir y llevamos el caso de mi hijo hasta la Sala Constitucional de Costa Rica. Luchamos por su derecho a la salud y gracias a esa lucha, hoy mi hijo se encuentra estable y agradezco a Dios profundamente por ello cada día.
Fatigue, headaches, and daily mucus are a constant reminder of what life is like living with a long-term chronic lung condition such as I have.
So living with severe asthma is definitely a problem for many people in this world. and we need to make sure that our air is clean so that we are not affected by pollution.
This summer here in Toronto, we had several rounds of wildfire smoke. This caused an air quality index of 11 plus, which is the maximum here in Canada. This was very difficult for me. It injured my lungs gradually over days.
It's distressing that the treatment I currently receive is not really helping very much. I can only walk about 50 meters, and I have trouble doing a lot of things.
Alhamdulillah, saya berobat ke RSUD Karawang, telah menjalankan kemoterapi sebanyak 6 kali. Berat badan saya naik 15 kg dan nyeri sudah sangat berkurang. Dan saya dapat aktivitas dan dapat berkumpul bersama keluarga, lagi dengan anak-anak di akhir hidup saya yang selalu mensupport saya.
Challenges were the investigations that we couldn't get at our facility, being a resource limited country. Some facilities don't even have just x-ray, and also the challenge of inhalers. We can't deliver inhalers without a spacer and a mask in his child who is 2 years old. So we had to also get a way of getting them the spacer and mask, and the inhalers also, because they're used for quite a duration.
تعد برامج التأهيل الرئوي علاج فعال لتحسين الأعراض وجودة الحياة، لكن وجودها في الأردن محدود جداً لعدة أسباب، من ضمنها نقص التدريب وغياب الدعم والتشريعات.
Free access to sirolimus, the only effective LAM treatment, has been transformative for Brazilian patients. Additionally, the establishment of 16 treatment centers across the country, specialized pulmonologist training, the creation of a patient registry, and a lumbar support on social media have greatly improved the quality of life for those living with LAM in Brazil.
When the medication came out in 2003, I was placed on it, and within 6 months, the quality of my life has improved dramatically. Unfortunately, this drug is very expensive. Currently, I was looking at what my insurance covers for me and what the cost is, and it's close to 100,000 American dollars, and we're only in the month of August per year.
Unfortunately, in Australia, we don't have access on the PBS, which is the government-funded scheme, to alpha-1 antitrypsin infusions.
Home-based PR underscored the role of digital infrastructure as connectivity and monitoring challenges pointed to the need for user-friendly technology and training for remote supervision. Social factors such as exercising in front of relatives, household environment, and space availability emphasized tailoring PR approaches to individual comfort and context.
A través de esta asociación, acompaño a pacientes que enfrentan las mismas situaciones y barreras que nosotros vivimos en su momento. El acceso a exámenes médicos, el diagnóstico oportuno y el acceso a tratamientos de muy alto costo. Hoy ayudamos a esos pacientes y caminamos con ellos y defendemos su derecho a la salud. Nuestra misión es clara: luchar, educar y empoderar a los pacientes en Costa Rica. Porque cuando los pacientes están informados, unidos y llenos de esperanza, se vuelven más fuertes.